Before entering the room, I'm going to check the doctor's orders, of course, and then I'm also going to wash my hands. Knock, knock, knock. Hello, my name's Kiera. I'm going to be your nurse today. Can I get your name and date of birth?
John Doe, May 16th, 2000.
All right. And are there any allergies I need to be aware of?
No allergies.
No? Okay. So the doctor ordered for your CVL dressing to be changed. Is that okay?
Yes.
All right. First, I'm going to don my non-sterile gloves. And then I'm going to check his wristband and make sure all of the information matches up and that it's correct. I would also put a mask on my patient and make sure his head is turned away from the CVL dressing site. At this point, I would raise the bed, but the bed is already raised. And then I would also lower the side rail. I would also come over and look at the CVL dressing site and make sure there is no inflammation, edema, any swelling of any sort, or any kind of redness. Also drainage. And I'm also going to ask the patient if they have any pain around their CVL site. Do you have any pain around your CVL site today?
No pain.
No pain? Okay. At this point, I am going to go ahead and lower the blankets. I'm going to come over here and grab my kit. Before I set it down, I'm going to make sure that it hasn't already been opened and make sure that there's no puncture wounds of any kind. And also turn it over and make sure there is no moisture in the package as well. I'm going to set my kit down. And I am going to make sure my face is not over the kit and then also push it away from me. Very carefully, you want to grab your mask, making sure not to touch anything else in the packaging. After you have your mask on and the patient has their mask on and their head turned away, you can go ahead and start removing the old patch. When removing the old patch, you want to make sure to go around the outer edge and then into the middle. As you're doing this, you want to be really careful to make sure that you're not tearing the skin on the patient or causing any kind of trauma to the patient, and also that you're not pulling on the actual CVL site. As you get closer to the middle, you want to pull away from the direction that the CVL is coming out of and discard of this. We don't have a bio patch right now, but if we did, I would take it from the table and open it up over my sterile field and let it drop into the packaging, but we don't. At this point, I can go ahead and remove my gloves and re-hand hygiene. After I've re-hand hygiened, you want to very carefully grab your sterile gloves out of the packaging, making sure you don't touch anything else. Using the pinching method, you want to grab your dominant hand glove and slowly put your hand in here. Using your sterile glove, you want to use the scooping method for your non-dominant hand and place your hand into the sterile glove. After they are both applied, you can go ahead and adjust as needed. And now you can grab your sterile filled extender out of your packaging, being very careful, making sure not to touch anything else. And very carefully drape this over your patient, making sure not to touch your patient. And then you can adjust as needed. After you've done this step, you want to go ahead and gather your supplies and put it on your extended sterile field. Once you grab your Tachoderm, you want to go ahead and remove it from its packaging and throw that away. At this point, you want to grab your gauze and carefully place it over the lines, making sure to keep this hand sterile as possible. After you have grabbed the lines with the gauze, you want to get your alcohol swab and go from the site outwards, making sure to clean up any blood or leftover gunk around the site. And then you want to take it, making sure not to go over the sterile field, and throw it away. After you're done with that, you want to go ahead and get your CHG stick, pop it open, and scrub vigorously around the site and on the top of the CVO. You want to do this for about 30 seconds and then an alcohol swab for about 15 to 30 seconds and throw that away. After you're done with that, you can go ahead and get your Tachoderm and very carefully place it over the CVO. At this point, sterile field is over, and you can just go ahead and make sure that everything is pushed down very carefully. Grabbing this right here, you want to do your initials, the date, and the time that you placed the CVL dressing. And then place it on top of right here. Can you go ahead and press that before I go any farther? Turn it back on. Sorry for the inconvenience. After you're done with this, you want to go ahead and grab your PRN port. It would already be closed, but what you want to do is open it up to where you only have your port, and grab your flush and hook it up on here. Once it's hooked up on here, you want to go ahead and flush it in the bag and set it aside for later, making sure it's still in the bag. You want to get some alcohol swabs and go ahead and prep them to change out your PRN port. Grabbing one swab, you want to go ahead and clean on the actual port all around for about 30 seconds. You can even go down the line if you would like, just making sure everything is nice and clean. After you're done with that, you can throw it away and then take off your port and also discard of that. After you do that, you want to go ahead and clean the top of this, making sure to get any dried blood or anything that could be built up around there off. After you've done this, you want to keep it away from the skin and then grab your other port and take it out of the packaging and place it straight on here. After you're done with that, you want to make sure your line is not clamped. You want to pull back for blood and then flush your line. After this is done, you can go ahead and take this off. And if you feel the need to, you can always wipe it down again. Oh my gosh. Around and on top of the port for about 30 seconds. After you're done with that, per hospital policy, you can place a cap on it. And you're done with your CBO. You can redress the patient and clean up the mess that you've made. Saving that for later. All of this would get thrown away, but for the sake of the video, we are keeping it. After you have cleaned up your area, you want to make sure the bed is in the lowest position possible and that the bed rail is up. You want to make sure the call light is by the patient and the bedside table is also in reach. For documentation, you want to make sure you want to document the tools that you used, the procedure that you did, and how the patient tolerated it. And then of course you're going to ask the patient if they need anything else. Do you need anything else today before I leave?
No, ma'am.
All right. And you can go ahead and take off your mask, take off the patient's mask if you need, and you're done.